Warning from the CDC tonight, Americans should avoid non-essential trips to China as the coronavirus continues to spread.
Meanwhile, here in Northeast Ohio, hospitals are screening for potential cases. Lena Lai shows us what goes into detecting the risk.
Fear over the coronavirus is growing overseas, with the number of deaths in China rising to 81 and more than 2,700 infected. Here in the U.S., just 5 confirmed cases. But the CDC says 110 people are under investigation in 26 states.
Right now, people are erring on the side of caution, which is probably a good thing.
University Hospital says that over the weekend, 3 patients walked into the Cleveland ER wearing masks, concerned that they may have contracted the deadly virus. They underwent immediate screening, and based on their travel and their contacts' travel information, they were deemed not a threat.
If we get any history that we're concerned about within that triage, we'll try to get them back to a room as soon as possible.
Following CDC guidelines, suspected patients would immediately be whisked away into an isolation room with negative pressure, meaning air drawn inside the room can't flow back out.
So whatever the patient has in the room is not getting out into the rest of the hallway.
And healthcare workers follow the same protocols like potential measles cases, wearing full gowns, special respirator masks with filters for infection control, eye protection, and gloves.
Do you feel that UH is ready?
Yes, I do.
Ready, but realistic, because the coronavirus risk is very low. Instead, they remind you that the flu has already killed 54 children in the U.S. this season, including 1 in Cuyahoga County.
So if people can do their part and get the flu shot, it's just more protection for themselves and their families.
As for the coronavirus, conflicting information tonight. You see, Chinese health officials reporting that patients with the virus are contagious for days before showing symptoms, making it easier to spread. However, the CDC says it has no evidence of that. Russ.
All right, Lena Lai in the newsroom. Thank you.
You bet.